office. And it's our job to oversee all county programs, services, and facilities, and help staff understand how to comply with the ADA, the Americans with Disabilities Act, and the California Fair Employment Housing Act, the FEHA. Again, my name is Cheryl Bennett, and I've worked in the Disability Compliance Office for over 20 years. And a big part of my job is also interacting with the community. The county has a Disability Advisory Commission that's made up of subject matter experts, both technical experts and people with lived experience. I meet with them almost weekly, and they advise us where the barriers are in county programs and services. So they have helped me understand a lot about interacting with people with disabilities and how to make our programs more inclusive. And I'm very pleased to have today as my co-trainer, Ms. April Wick from Resources for Independent Living. April?
Hi, thank you, Cheryl. I'm excited to be co-presenting with you today. And I apologize, I am going to keep my video off because it started to do some things. So I'm April. I'm the Executive Director of Resources for Independent Living, and we are an advocacy and resource center for people with disabilities and older adults in Sacramento and Yolo counties. And I'm really excited to be here to share our experiences with you and to impart some knowledge. And I think it's going to be a great training. I have been involved in disability advocacy for 14 years. And I've done various jobs from benefits counselor to systems advocate to executive director. And we are one of 29 what's called Centers for Independent Living across the state of California, which means that there's 29 of us. We're all our own individual nonprofit with our own staff and board, but we all have the same core services and ideals. And I'll share a little bit more about RIL later in the presentation. I'm going to kick it back to Cheryl to start the PowerPoint.
Okay, so today our learning objectives are going to be to gain an understanding of the ADA and the Fair Employment and Housing Act, their civil rights and responsibilities, our responsibilities for barrier removal. We're going to take a look at disability in our culture, language that we use, identity, public perceptions, and stereotypes. We're going to help you identify discrimination, what that looks like for people with disabilities, and access barriers in our systems, both environmental and attitudinal. We're going to be taking a look at our own selves today. We're going to give you some tips for effective communication and respectful interaction with people with disabilities. And we're going to give you some resources for planning ahead and how to work with us to get the resources that you need to create inclusion in county programs.
So when you think of people with disabilities, what words and images come to mind? And you can either put it in the chat box, or you could use the raised hand function, which is located under reactions, because we want to keep this interactive. So please, if questions come up. So tell me just what are some words and images and or phrases that come to your mind? Oh, it's a quiet group today. Oh, Liz.
Yeah, so when I think of disabilities, I specifically think of physical disabilities. Like Bobby said in the chat, I think of wheelchairs, and yeah.
Okay, so physical disabilities. What other physical limitations from Alden? Yeah, some people think of physical limitations. Okay. So a lot of physical. Armando, were you going to say something?
Yeah, it's just, I've learned over the last few years that, you really can't put a descriptor on your disabilities. So many are not seen, and that you just need to be ready for everybody.
That's a really great point, Armando, is that, not all disabilities are visible. Quite a few people have invisible disabilities like chemical sensitivities and things like that. So in the chat, Eugenia wrote blind and deaf. Bobby wrote schools for the deaf and blind, and then also neurodiversity. Neurodiversity is kind of a phrase that has gained traction in the last decade or so to describe people on the autism spectrum who that word talks about how, you know, there's diversity in the way people's minds work, as opposed to thinking of it as something that's a deficit. All right. Well, those are a good start. So keep thinking about that. I'm going to tell you a little bit about some disability facts. And so you may not know that 61 million US adults live with a disability. This comes from the Department of Labor and the CDC website. If you want to go to either the CDC website or the Department of Labor, they have some great facts. So that's 26% of US adults, and over 40% of people who are over 65 have a disability. And something that has unfortunately not changed much since the passage of the laws that we're going to be sharing with you is that the labor participation rate of people with disabilities is still really low compared to the labor participation rate of people without disabilities. So 75% of people without disabilities participate in and that's just a fancy word for, you know, working. So 75% of non-disabled people work, and 33.2% of people with disabilities are working. And so that's a really big issue. And we're going to kind of delve into why that might be, and the answers might actually surprise you. Now let's look at how disability intersects with race, ethnicity, and gender. So one of the things that I know, another word that has gained a lot of traction is intersectionality. And so when I think of people with disabilities, a lot of people kind of think of us as a monolith. And I should have said at the beginning, it's a little weird that you can't see me, but I'm a wheelchair user. A lot of you know me. I recognize a lot of you that you've met me before, but I'm a wheelchair user, just so you know. And I'm also a white woman and a woman, and I'm probably upper middle class, and I am Scottish and Irish. And so those are a couple of my identities. And so when you think of intersectionality, think about how, you know, I might be discriminated against because I'm in a wheelchair, but no police officers have ever pulled me over because of my race. So there's different times when privilege and lack of privilege kind of interact with one another in different contexts. And also intersectionality is a way of describing diversity too. And that's really cool that we're not just off to the side, a monolith. And so just some ideas here, to back that up, is that 1 in 4 women have a disability, and 2 in 5 non-Hispanic, American Indian, Alaskan Natives have a disability, and that African Americans are more likely to have disabilities than any other race and ethnicity. And disability is present across all ages, ethnicities, and cultures, and anyone can join the disability community at any time. And in the past, you know, when I've heard that at presentations, I thought, oh, do you have to scare people? But disability is just, the point of that is that disability is natural, and it's not like, dun, 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 you could get hit by a bus and end up like me at any time, and so you better be nice. What it means is that it's just naturally occurring. You know, you could break your leg, or you could, you know, develop a traumatic brain injury, or as you age, most people who are going to age, as you saw in the previous slide, are going to have disabilities. And so it's just a natural part of the human experience, and it's not something to fear. Next slide, please. So let's talk a little bit about the way that the Americans with Disabilities Act defines disability. So we all have our own definitions of disability, but the ADA has a very specific definition that we're going to build on. So the ADA defines disability as a physical or mental impairment that substantially limits one or more major life activities of such individual. There is a record of such impairment, or you're being regarded as having such an impairment. So you may not have a disability, but if people think you have a disability and you are, you know, adversely impacted at your job or something like that, discriminated against, you are covered under the ADA. And something that I also want to say is that in the past, the very first Americans with Disabilities Act was passed in 1990. And there were a lot of court cases surrounding this definition of disability. So the Supreme Court kind of gutted a lot of parts of the ADA because the way that the disability was defined in other parts of the law was really narrow, and people were feeling like they had to prove their disability. You know, what do you mean by substantially limits? And so then the ADA Amendments ADA Amendments Act was passed in 2008, and that helped make things less defined, so that people not less defined, but like it helped to kind of broaden the term so that it wasn't such a steep climb to prove that you had a disability and that you were being discriminated against, is the easiest way to put it. All right, next slide, please. So let's talk about the Fair Employment and Housing Act. And at RAL, we do this quite a bit. That's actually a really strong act that we assist people with FEHA complaints a lot at RAL. And FEHA, I call it FEHA, it's the Fair Employment and Housing Act, or FEHA. So this law defines disability as a physical disability which includes, but is not limited to, any physiological disease, disorder, condition, cosmetic disfigurement, or anatomical loss that affects one or more bodily systems and limits one or more major life activities. A mental disability includes, but is not limited to, any mental or psychological disorder that limits one or more major life activities. So the key takeaway here is that the law is very broad regarding who is covered. So if you are providing a service on behalf of the county and you get a request, or you see an obvious need, you don't want to spend a lot of time and energy figuring out whether someone has a disability or not. We are expected to respond to requests as promptly as possible to ensure our clients and patients and customers are getting what they need. So that's really what we want to impart to you today, is people get really stuck on, is this person this or is this person that? And you should just lead with believing the person and get that person served. Next slide, please. So thank you for giving me a list of some disability types earlier. Some other ones that I didn't hear were psychiatric mental health disabilities, intellectual and cognitive, developmental learning. Someone very quickly and astutely said a lot of disabilities are hidden. So a lot of people have like chronic pain, or they have chemical sensitivities, for example. And then I heard blind, deaf, and physical. A lot of people think that, when they think of that image of a wheelchair, or they think of even the international symbol of disability is a person in a wheelchair. So that doesn't reflect the vast diversity of the way that disability can express itself. I actually have multiple disabilities. I also have a pretty severe learning disability that I don't think about very much, but it definitely comes into play when I'm doing things like trying to do math or things like that. But as I've grown in my career, I've learned how to adapt. I have some pretty interesting conversations with my finance person, but she has learned my brain and I've learned hers. And I have learned how to read the financial statement, and it's been fun. So that is just a part of our journey. So there are not many specific disabilities. Let me see here. So one of the things that I also want to say is that some of the disabilities that are kind of mentioned in the two laws are episodic, like diabetes and epilepsy. Addiction. For addiction, you have to be in recovery, but not currently using the drugs. So that's very important. You can't just say, oh, I was discriminated against because I came to work just, mad smacked on coke. I just went into the cocaine, and then my boss didn't like that, and darn it, I'm being discriminated against. That's not how that works. So, but if you say, I have a drug problem and I'm in recovery, then you can talk about that. So there's also, bodily function issues, and that's one of the major life activities, right? Eating, dressing, bathing, using your bodily functions. And now what we're seeing with COVID-19, we're seeing a lot of people who are not just developing temporary disabilities because of COVID, but who are long haulers. So people who are going to have heart issues and lung issues, breathing issues for months after they have COVID. And so I think it's going to be a fun challenge to figure out how to accommodate people and bring them into the workforce or back to the workforce or into the workforce, and how we have to account for how COVID has really changed the landscape of how we look at disability, because a lot of people are going to now have pre-existing conditions that are covered under those laws. Next slide. And I'm going to kick it back over to Cheryl.
All right, before we move on, did anybody have any
Questions?
final
Yes.
questions or thoughts about disabilities, the definitions? Okay.
This is Bobby.
Hi, Bobby.
One of my questions is, do you have like statistics on folks that have multiple disabilities? I think in my experience, many of them don't occur in isolation from another.
That's a very good point. One of the challenges in the disability advocacy world is getting good numbers on who's really out there and what are their needs. Because a lot of this information is self-disclosed, and sometimes people don't want to acknowledge or publicly disclose the disability, or they may not even understand it as a disability. Like April said earlier, some of the episodic conditions, people don't really think of them as disabilities. I hear all the time, "Oh, I'm not disabled, I just have diabetes." Well, that is something that qualifies as a disability under the ADA and FEHA. So the numbers are really muddy for that reason. And so that's why we just encourage county staff and our community partners, if you're not sure, just honor their request.
Yeah, and you know, at RAL, we do ask people if they have multiple disabilities, and actually multiple disabilities is the #1 type of disability type that is self-identified. But Cheryl's right, and that has also been a challenge as we've done advocacy. Like, I know that as we have done advocacy, you know, regarding, you know, vaccines and access to vaccines, and I'm speaking on behalf of RAL. I am authorized to say these things on behalf of my agency. So some of the things that I'm saying because Cheryl might not be able to say it because she represents the county. So this is what April's saying, is that, you know, we've tried to get people with disabilities as a priority category, but a lot of the public health officials at the state are like, well, where's the data? And so that has been a challenge. And then Liz wrote in the chat that if you have any thoughts or questions, just please raise your hand, unmute, or add to the chat. So that's great. All right, I think we're ready to move on to you, Cheryl.
Okay. So we're talking a lot about social justice these days. It's another one of those buzzwords that get thrown around a lot. And here we have a photo of people with disabilities working for social justice. And they're marching in the street, and they're carrying a sign that says a famous quote from Martin Luther King: "Injustice anywhere is a threat to justice everywhere." And this photo is taken from a big disability rights march that occurred in Washington. And it was this advocacy was very instrumental in getting the Americans with Disabilities Act passed way back in 1990. So what does social justice look like for people with disabilities? It's really easy to fall into the trap of thinking that equality means treating everybody the same. We just treat everybody the same and everything will be fine, right? Well, quite often, especially for people with disabilities, that does not achieve inclusion. And we have a little graphic here. The graphic on the left labeled equality. All of the kids watching a soccer game are being treated the same. They each have a box of the same size and height to stand on to be able to look over the fence, which is a solid wood fence, to see the game. The problem is, even though they're all being treated the same, the short person on the right side can't see the game. So we're treating everybody the same, but that's not equality, is it? Somebody's getting left out. In the middle image, we have equity. And I like this image because it's a really good metaphor for how reasonable accommodations often play out. A lot of times when people think about having to accommodate people with disabilities, they think that they're going to have to make major changes or do some things that are going to be very expensive. And often it's just a matter of taking the resources that you have and making some adjustments. So in the middle image, we have the same 3 kids watching the soccer game behind the same solid wood fence. And we have the same 3 boxes, but they've been rearranged so that now the short guy on the right is standing on 2 boxes, and that makes him tall enough to see over the fence and see the game. That's equity. That's inclusion. But if we really want justice, how about we don't put the barrier there in the first place? We think beforehand about inclusion. So the image on the right, there's still a fence, but it's a fence everybody can see through, and no special equipment like the boxes or any other accommodations are needed for everyone to enjoy the game. This is another example of what social and environmental justice looks like for people with disabilities. You've probably all noticed these bright yellow tiles with bumps on them at intersections around Sacramento County and various places. In Sacramento County, they're required to be bright yellow. It's called federal yellow because that is the most visible color for people with low vision. So in this image, we have a person who's a cane user, somebody who has some blindness and is traveling independently, and he's able to do so by use of these yellow tiles. These tiles indicate by sound and texture that the person has come to a place where they are about to enter a vehicular way. So if these are constructed properly, there's a hollow space underneath it that makes a sound difference. It's different from the sound of the cane tapping on the sidewalk. It's more, with the hollow sound underneath, it's more like a pop, a drum beat. So a totally blind person would then know that they've arrived at an intersection. They would feel the bumps under their feet. If the curb ramp is installed properly, they can use those bumps to align themselves properly. And when hopefully there's a signal there, when they get the signal, they can cross the street. If there's no signal there, they're relying on the sounds of the traffic passing by. So they're taking a huge leap of faith, stepping out into traffic. These devices are very helpful for people to navigate independently, people who are blind or visually impaired. The next image on the top right is called an audible pedestrian signal or an accessible pedestrian signal. And these help people who are blind and visually impaired, and also people who have hearing loss to cross the street. This particular type, this is the most accessible type that's pictured here. It makes a sound when it's time to cross the street. And also the button is tactile, and you can press and hold the button and it will vibrate when it's time to cross the street. So if you have both vision and hearing impairments and can't see the walk sign when it illuminates on the other side of the street, or you can't hear the audible signals, you can still get a vibro tactile. It buzzes or vibrates when it's time to go. And then the bottom image, we have a person using a manual wheelchair coming down what looks like a fairly steep ramp. I say it's probably steep because it has the handrails, which is a requirement when a ramp is exceeds the slope a little bit, which can be very dangerous. This ramp looks like an afterthought, as many of them are, for buildings that were constructed prior to the ADA, and they had to create some afterthought workaround because wheelchairs don't go upstairs. So these are just some examples of things that you will see in the public right-of-way that represent social and environmental justice for people with disabilities. This enables them to go where they want to go independently without help, just like everybody else. So path of travel is something that's been a hot topic with this group for the last few weeks. As many of you know, we've had county staff come through and do an evaluation on the path of travel from the parking lot or from the sidewalk, the public right of way. into the facility where you are currently delivering COVID testing services. So the ADA and the FEHA require, the California Building Code require, that we create accessible parking, a clear path of travel without obstructions from the street or the sidewalk and the nearest public transit stop, and an accessible route into and through the public areas. So some of you may have participated in those walkthroughs and evaluations with county staff. Would anybody like to share some of their experiences and maybe some things that they learned in that process?
We have a comment in the chat. Bobby wrote, these are great examples of what I understand as, oh no, he just wrote that. These are great examples of what I understand as the distinction between accessibility and accommodation. So he just wrote that.
I can comment a little further on that. I know during our walkthrough, something that came up was even the grading on the concrete walkway that we had, depending on if a person was just moving through it or if they had to stop there, that would cause violations against current laws and regulations. So that was a learning point that, I don't normally think about. And so it was a good thing to be reminded.
So yeah, those are very easy things to miss. Not a lot of people are aware of issues around slopes and cross slopes of a walkway. And if they're too excessive, they can actually tip a wheelchair over. For our purposes here, a lot of you received your reports with they were done up originally as though the way we would do any county facility where the ultimate plan is to make those construction remedies. And often those are very expensive and costly and time consuming. And many of our community partners don't really have that in their budget. Nevertheless, and in fact, some of you folks are operating these programs out of churches, which are exempt from the ADA. But under the ADA, if you are helping us operate a public program, a county program, that program must be accessible. So we don't require that every aspect of your facility be made accessible, just that the path of travel is clear into and through the area of service from the parking lot and the public right-of-way. And there are temporary mitigations that we can help with to make sure those things get worked around without our partners having to make those huge barrier removal expenses if they can't do it. We encourage them to do it. We encourage you all to make, to take this information, and if you have the ability to make the construction remedies, we certainly encourage you to do that. But for our purposes today, we just want to help you understand how to create access as best we can with the resources that we have to ensure that accessible path of travel and effective services while you're operating this county program. Does that make sense? Did anybody else have any other experiences to share about your walkthrough or lessons learned? Okay, well, there will definitely be more discussion around this. I, along with my colleague, Jeffrey Lubenko, who is an engineer architect, are making site visits after this training. We've already done one, but we're going to visit every site and make sure that our community partners understand the information, and we will show you step by step how to mitigate the access barriers that we found. So stay tuned for that. So just to be clear, while I'm sure it's in everybody's heart to provide the best services for everyone, we have some specific responsibilities as people operating county programs and services for public access. And that is that we must provide equal or equivalent access to programs, services, and facilities. And again, like our little graphic a couple of slides earlier, equal doesn't mean the same. It doesn't always mean the same. It means that we make sure they get the same information, the same service, although it may look a little different how we provide it. We must reasonably modify our practices, policies, and procedures if they create a barrier. So a real simple example is Sacramento County has a no pet policy in all of its buildings. We don't allow people to bring their animals. Well, obviously, if it's a service animal, we must modify that no animal policy to allow a person using a service animal while they're in a county building or receiving county services. And again, proof of disability is not required for reasonable modifications or for public accommodations. We never want to ask about the disability unless there are questions we need to ask about what their needs are. But generally we can do that without discussing the nature of their disability. So how do we get here? How do we get to this place? I'm going to let April talk a little bit about the history around disability discrimination.
Thanks, Cheryl. So this is going to be a sad slide. I think it's really important to note that we all bring our histories with us. And so, many of you may have been taught in school or have personally experienced yourself, bias in medical decisions. And we're seeing that play out today. We've seen it play out throughout history, and we've also are seeing it play out in the COVID world. So, unfortunately, the history of the medical field and the public health field, has some dark periods where, it used to be standard practice to think that, people who are not, basically, if you're not white and you're not a man, and you have a disability, you were considered inferior, and that is still true. And so, there used to be a really active eugenics movement in the United States. And so there was actually one of the things I remember visiting the Museum of Modern Art in New York, which is an awesome, beautiful place. Well, they used to host eugenics conferences back in not too distant past. So, a lot of people think, well, all this is in the past, but really the past is not past, and it is playing out every day in the way that medical decisions are still being made. Does that mean I'm saying that all doctors and public health officials, are racist and sexist and ableist? No, I'm not saying that, but I'm saying we bring our histories with us, and we are participating. Whether we actively know it or not, we are immersed in that structure that was created. So I'm sure that many of you are aware that, Black people used to have, forced experiments done on them and things like that. A lot of you know about the syphilis project, where people were, they thought that they were doing something else, but they were actually given syphilis. And a lot of them, got sick and died. And so that is why, when we talk about vaccine hesitancy, or we talk about, oh, it's safe, just go to the doctor, a lot of people with disabilities, particularly people with disabilities of color, are like, well, I don't know. My grandfather was told that he was just going into a room to get a test and he got syphilis, and the government did that. So, the government has participated actively in that in the past. And that's playing out today. A couple of things, there was eugenics, which is the idea that, some people, so that gene, there's a certain, pure gene pool of, white, blonde hair, blue-eyed, perfect people and that all the other people should be weeded out. And a lot of people with intellectual and developmental disabilities were forcibly sterilized really up until, I believe, the 70s. people were, it might have even been the 80s actually, that people with intellectual and developmental disabilities, their families could just say, yeah, just, we don't want her to get pregnant. Even though we know that, you know, just because you have a disability doesn't mean that you shouldn't have autonomy over your body, and that people with disabilities can be good parents, and that there's nothing wrong with having a child with a disability. Also, it used to be commonplace that if you had a child with a disability, that they should be put in an institution. I remember when I was born, my dad tells me the story about two different doctors. And the first doctor came into the room and said, well, April's going to be a vegetable, so you should just forget about her and have another child. And there's a place that we can send her. And so my dad didn't listen to that doctor. Luckily, in a very short period of time, another doctor walked in the room and said the very opposite, which is, you know, I've seen this kind of disability before. They grew up to have very happy lives. Just treat her the way that you're going to treat her non-disabled siblings, send her to school. She'll be fine. So he believed that one. So yay.
Thank God.
And so, and also I think the important thing to know too, kind of, and we're actually still seeing a disproportionate number of people with disabilities being institutionalized, even though a lot of mental and intellectual type institutions were decentralized and moved to community-based care kind of in the 80s and 70s and 80s and on. We're still seeing a disproportionate number of people with disabilities who have higher needs moved into institutions. I mean, now we have things like Medicaid waivers, and we have things like home and community-based services and long-term services and supports, which are just words that mean that the state will give you benefits to be used in the home, to be integrated into the home and community environment as opposed to having that care done in an institution. And aside from it being obviously the right thing to do, it's actually cheaper and more humane, of course. Shouldn't really have to say this, but it's cheaper and more humane to have people be in the community where they want to be participating in the life of the community than locked away and forgot about. Some of you may have watched The Crown. I have not partaken in that show, but a lot of people don't know that Queen Elizabeth actually has a cousin who I believe just recently died, who had an intellectual disability, and her family chose to send her to an institution, and nobody really knew who she was. And she missed out on, you know, being able to be a part of her family. Imagine what that would have been for, you know, representation if she could have been out on the patio just smiling at everybody and waving and everything. So let's kind of go to move on from this slide a little bit. Oh wait, no, go back. I have one more thing. I just want to say one last thing. So let's talk about the present day. I talked a little bit about history, but like I said, the past is not past. So let's talk about the history of rationing care during emergencies. So just recently, Disability Rights Oregon unearthed several cases in Oregon of, in the early days of COVID, people with disabilities would go to the hospital, and either some of them had COVID and some of them didn't, but they and their caregivers were with them, and they were told, well, because of this person's quality of life, you know, we're not going to keep them on the ventilator because we need that ventilator for other people. And this was in the early days before even the discussions of rationing care were a reality. So what they found in Oregon in the last spring was that the system was preparing to help the people that the system valued more by rationing care for people that the system valued less. And they did, the tragedy of it was that they didn't even have a valid reason, just other than the fact that these were people with disabilities who needed the ventilators and were sick and needed help, and they were not given the care that they needed, and they were encouraged to go off of life support. And so Disability Rights Disability Rights Oregon is actively suing the state for that. But that is an example of, and you see that throughout the state, as the different states in the country as well, about rationing care. And again, it's because the system has a preconceived notion of who it values more, and so it rations care from who it values less. So because I'm fun, let's go to the next slide after we have fun with that. Cheryl?
Yes.
Can you, oh, okay, I couldn't see it. So this brings me to the medical model of disability. So the medical model of disability is this idea that people with disabilities are sick and broken, they need to be fixed. They're the ones that need to adapt and fit in. Like, well, she's messed up, so she's got to go to an institution and just be locked away. Or, she's the one that can't climb the stairs. Why does she want to go to the class that's on the second floor? What's her problem? Or that you should be institutionalized, stay in your house. And non-disabled people will make their life decisions for them. Like maybe like your mom or your dad or your caregiver makes decisions for you. And there's an emphasis on the impairment. So there's something wrong with you. Next slide. So can you see how this makes the person with the disability the problem? So kind of what you have an image of a wheelchair on a brick wall, and then you have these words feeding into it. And it says like, you're confined, you're sick, you need help, you're bitter because you try so hard, it makes you angry. I've gotten that one a lot. You can't work, you're housebound, can't use your hands, you got some problems, and it's important to see that this is where prejudices come from. And I'm actually going to look at the chat box for a second. Okay, we missed some things in the chat box, and we're going to come back to those, and I will do a better job, but it'll be relevant again in a second. So the medical model makes the person with the disability the problem and presumes that they should adapt to the existing environment, and if they can't, that's just too bad. Next slide. So let's look at a healthy version of the other model of looking at disability, which is a healthier version. The social model of disability is based on the notion that people with disabilities can make their own life choices and decisions. Imagine that. It's really not about the person being incapable. It's about the barriers in our environment and in our own thoughts and attitudes. So it's not that there's something wrong with us, it's that there's something wrong with the way people see us. So the social model states that, the physical environment creates barriers to daily activities, and that the cure to that is actually removing the barriers in the built environment, not actually curing the disability. And you need to also address attitudinal barriers. So, laws can only go so far, but if you still have prejudice in society, it doesn't matter. I think we see this a lot with race, is that even if something cannot be proven as under the law actively racist when it's happening, it is perpetuating racism because it's an attitudinal barrier that somebody's facing. And it keeps playing out. It's like de facto. And then ableism, complex form of prejudice that is common, such as sexism and racism. So ableism is just a term we use to talk about that, about prejudice against people with disabilities. Next slide. So here's like the opposite here. Here is a picture of a world, and what's kind of feeding into that is, this represents the social model, which is like, well, if there's no alternate formats, poor job prospects, inaccessible transportation, your families are isolated, lack of accommodations, poverty, there's no parking spaces, poorly designed buildings, those just are examples of how our environment disables, not the impairments. And functional needs are needs, not special. So I hate the term special needs, because speaking for myself, there's nothing different about me like eating and going out than anyone else. And so I may have to use an adaptive device to do certain things like my wheelchair, but that doesn't mean I have a special need. It just means I'm a person and this is how I do things. So we'll go to the next slide. All right. So talking a little bit about, again, this idea of attitudinal barriers. When we think about barriers, most people think of things like buildings that don't have ramps or elevators, or that a blind person can't read printed materials. But in reality, the biggest barrier for people with disabilities are the attitudes and perceptions of others. And these are things that we have all learned unconsciously from outdated cultural beliefs and stereotypes. So this idea that we have been immersed, that we all bring our histories with us, and we have been immersed in ableism our entire lives, whether we know it or not. So, you know, there's some people who are afraid of people with disabilities. They're afraid, well, I'm going to say or do the wrong thing, and so I avoid people with disabilities. And I've seen that a lot in my life. I remember when I was in college, I didn't get invited to a party because, and I asked, I was like, I thought, you know, I heard about this party, and I'm kind of like, did I do something wrong? Did I like hurt someone's feelings? And she goes, no, it was upstairs and we didn't want to hurt your feelings, so we just didn't invite you. And I'm like, well, you could have had the party at my house or we could have had it at a different place. But they kind of just didn't know what to say. And then sometimes people would just, that it's better to just ignore things. And that actually doesn't lead to progress. And I would actually rather people ask me than not ask me, you know. And if I don't want to answer a question, then I will respectfully decline, but at least you're giving me the option to interact with you. And a lot of people believe that individuals with disabilities are given unfair advantages. I remember that, I know that that's played out a lot in society, where they assume that reasonable accommodation means you're getting special treatment, where in reality, the concept of reasonable accommodation is that a qualified person with a disability, so you actually have to meet the qualifications for the job to be able to get that job. It doesn't mean, you know, that you can just, it doesn't mean that I can have no skills as an executive director and just show up and get that job because I have a disability. It means that if I'm qualified, I might get a desk that I can push my wheelchair under, for example. That doesn't give me an unfair advantage to doing my job. It just puts me at parity with people without disabilities. And then some people say hidden disabilities are not real. So I know I have a lot of friends who have chemical sensitivities, and they get a lot of, you know, they get laid up in bed for months at a time sometimes, and people judge them and think that they're not really disabled. And that's really unfortunate because then that leads to lack of empathy. Liz is going to jump off, but she'll be right back. And then I want to read what Alden said. He said that having increased knowledge of access barriers has given me a different lens of awareness of everyday tasks such as shopping, accessible or accessing healthcare, and working both in the workplace and from home, just to name a few common things most people do. So that's cool. Thanks for sharing that. So we are actually going to give you a break from our vocal stylings, and we're going to watch a video. And then we're going to ask you to tell us a little bit about what you see in that video.
Hey, April, I think you skipped a slide.
I skipped a slide, dang it.
Yeah, there's a second slide on attitudinal barriers. Starts with spread effect.
I just wanted to watch the video. So we talked about fear, backlash, and denial. Now, thanks, Cheryl, let's talk about spread effect, which is people assume that a person with a disability is totally impaired. So they assume that you are your disability, that you can't do anything. Like if you're blind, you can't eat, or you can't feed yourself, or you can't dress yourself, and that may be true, but it may also not be true. Hero worship. People with disabilities who work or live independently are brave or special, which is not true. You're just a regular person. It's funny, a couple of months ago, I was featured in the Sacramento Bee. I wasn't featured, but like I was in one of their sections where I had a coffee in my hand and I was just pushing my wheelchair, and it was just, and I was wearing a mask, and I thought it was cool they included my photo just for representation, but it was funny, a relative of mine like blasted my picture all over Facebook and was like, she's such a go-getter and she doesn't let anything get her down. And I'm thinking to myself, okay, the backstory of that photo is I'm in my sweatpants. I woke up 10 minutes before that picture was taken. And like I was late for work. So it's like, you know, I was just doing my thing, you know, drinking coffee, not doing anything special. But he was like, this is good. I'm going to hang this up in my wall to remind me not to have a bad day ever again. And I'm like, okay, whatever. So that's kind of an example of hero worship. So other common stereotypes, people that we're angry and bitter, you know, that we put so much energy into ourselves that we just are unworthy of love, and that we're just going to push everybody away. And that there's this idea that people with mental illness tend to be violent, and that's actually not true. That is actually statistically not true. And people who are blind have better hearing or tend to be more musically inclined. So I hear this a lot, where if you're deaf, or you're blind, you have your other senses take hold, and you become like you can go out and hunt for missing children or something. And it's like, no, that's actually not how that works. It's true that you may adapt, you may learn different ways to adapt, but that doesn't necessarily mean that you are like one of the X-Men and that things are like heightened. So those are just some common stereotypes. And now we're going to watch one of my favorite videos. And I'd like you to think about what attitudinal barriers are you noticing. So spoiler alert, you're going to see some attitudinal barriers and try to spot them.
Okay, here we go.
I can't hear the video. I don't think anyone can hear it, Cheryl.
Oh,
Just give us a moment.
apologies. Apparently, people are having trouble hearing.
Am I the only one that couldn't hear it?
I couldn't hear it either.
Well, it's captioned. I'm not sure what to do here.
You could also play it from YouTube and share your screen,
Let me try.
but
Is that better?
it's just garbled.
Oh dear.
I could try to pull it up.
Is it still garbled?
Yeah. Oh, and Liz said that reshare the screen in the bottom left corner, and then it's in the bottom left corner, it says share sound. One moment, we're gonna get it. And I'm looking it up as a backup while you're doing that, Cheryl, just to see if I
Thank
can.
you. Sorry, folks. Maybe this would be a good time for a break. We had a break coming up after the video anyway.
Yeah. How
Well,
about
let's-
we take a break?
Take 5 minutes, folks. Apologies, and take a moment and we'll figure out the sound. Thank you.
I used to have a direct link, Cheryl, to the video, and actually maybe I did find it. If I find the direct link, I could just share my screen.
What is person first language?
This is a different one, but I'm just playing with this for a second. Is this it? Nope.
So I've found if you just go to the search box and type disability sensitivity video, it usually is the one that comes up first.
Okay, I found it. So I'm gonna, and then this is a Verbo commercial, but that's okay. So maybe let me, I'm gonna share my screen and do a test. And I'm gonna have to make it bigger, but whoops. No, I didn't want to do that. That's not what I was trying to do. Never mind. Here we go. I'm gonna share my screen again. Okay, share. Can you see that screen?
I see a really nice house.
Yeah, can you hear
Okay.
it?
I can hear it.
Okay. I'll skip the ad. I'm just doing a test. Can you hear it?
Yes.
Okay, so maybe we could just use this one then. Okay, and then I'll unshare when it's over.
Okay.
It's not gonna be very big, but we'll just do what we can do. So let me.
I'm going to step away for 2 seconds. I'll be right back.
Okay. Let me know when you're ready.
Will do.
We'll come back at like 10:05.
I'm back, April.
All right. Is everybody ready to get started? All right. We got the video working. I think I said that we'd be back at 10:05, so I'll give people 1 more minute just because I don't want to take back what I just said. So at 10:05, we're going to reconvene, and then I shared my screen and you should be able to hear it. It's not going to be as big, but it's a worthwhile video. All right, I'm gonna play the video.
Good morning, Mom. Morning there, man. Morning, Alice. There's no need to be awkward.
Poor Bob. Like so many of us, he just doesn't know how to interact with people with disabilities.
It's pretty easy, really. People with disabilities are people first.
We need the same things that every person needs, like respect.
Good morning, everyone. Attention.
Okay. Maybe we need to be more specific.
The easiest way to show respect is to focus on the person, not the disability. It's okay. You'll get the hang of it.
One easy way to focus on the person is to watch the person signing and not their interpreter.
Or their companion.
It's really cool that you'd like to help, but do us both a favor and please ask me first. What you think might be helping?
I got you.
Wait,
Oh no.
might
Hey,
actually.
how are you?
If you'd like to offer
Good,
me help,
good.
let me hold on to your
Ignore
elbow.
any background noise. I'm doing a workshop on ADA regulations because apparently we've got a couple of facilities in the district that doorways are not wide enough and stuff like that. So I'm required to do this. So, but it is.
Can you mute, please? Somebody is talking on their phone and we can hear you.
Anyway, I did talk to Trini for quite a while yesterday. We had our psych meeting, and then I dismissed everybody except her because I wanted to talk
Tom
to her.
Anderson, please mute.
If we've
Hold
given
on a
you.
second.
And don't take it personally if I ask you not to. Remember that my service animal helps me all the time. Neither of us would like it if we were separated.
Remember, we make our own decisions. We sign documents, vote, volunteer, work, and pay taxes.
We get married.
So don't underestimate me just because I have a great smile.
Just because I'm blind does not mean I'm deaf.
Just because I'm deaf doesn't mean I'm blind.
And just because I use a wheelchair doesn't mean that I can't sweep you off your feet.
So take a deep breath, relax. We don't bite.
Unless we're really hungry.
There, ladies, how are you?
Hello. And if you're not sure what to do, just ask.
Hi, would you still like to see a menu?
No thanks, but can you please read it to me?
Sure, definitely.
Just treat us the way you would want to be treated, and we'll all be okay.
Good morning. Good morning.
Good morning, Alice.
Awkward no more. Nice job, Bob. Go forth and be human.
There's no need to be.
Sorry, I cut it. There's no need to be awkward. So I cut off the word awkward, but so, and then Cheryl, you can go ahead and reshare the PowerPoint on your end. What stood out? What were some of the examples of attitudinal barriers that you witnessed in this video? You can speak it, chat it, or type it, or raise your hand. I noticed one, there was hero worship. Holly Pauls wrote, wanting to help but getting in the way. So, this assuming the person needed help but not asking first. What other things stood out at you about this video? Okay. That they want to be, Eugenia wrote that they wanted to be treated with respect, just like everybody else. Yeah, like we're just like everybody else. There was also assumptions that, you know, deaf people were blind or blind people were deaf. And there was that aspect as well at play there. Do you want, let me know if you need me to resend you the PowerPoint.
Yeah, I'm sorry. For some reason it's gone off my screen here. Try again.
That's what we love about the code. In the before times, we wouldn't be on Zoom. Yay, it's back. Well, thank you for, let's see here. And let's see if I missed any in terms of, so we got the hero worship. Yeah.
I saw the spread effect. The Bob was yelling at the blind lady.
Oh yeah.
And then I also saw fear. When he got on the elevator, he just wasn't really sure how to interact with the gentleman in the wheelchair. He was trying to pat him and acting all uncomfortable.
Yeah, that was funny. He was like, why are you petting me like that? Hi, Bob. Okay. Ah. All right, let's move. Sorry. I am just getting back to where I am. All right, so let's, and someone wrote in the chat, disregard for the universal, Alden wrote, disregard for the individual's permission to assist.
Ah, good one.
That's a good one. All right, so let's kind of build on this and talk about inclusive and respectful language. And after I talk to you about these, I'm going to completely turn this slide on its head for fun, but I will build on that first. So in the video, the person talked about how people with disabilities are people first. And I always tell people in a customer service setting, it's always a good idea to default to the person first and the disability second. So an example, person who is blind, people who use wheelchairs. So you see, you put the word people first, and then you talk about their disability last. And to remember that a person is not their disability. You're not retarded, which is a horrible word, a quadriplegic, an epileptic. There's an emphasis on ability rather than limitations, and it's not a tragedy or challenge to overcome. Now, I will say that there's actually been a movement to take pride in our disabilities. So a lot of people have moved on individually from the person first mantra, and they have started to say, I'm a disabled person, or I'm an autistic person. And so that's when I say, while you're at work and doing your jobs, you should default to the person first mantra, which I think is the safest bet to be respectful at work or in your jobs, or in just when you're just getting to know somebody. But like my friends know that I'll say, well, you know, I'm a disabled person. And that all has to do with like claiming disability and not trying to dismiss disability. So there is this idea like, well, why do we have to put our disabilities second? Why can't we just own it? And then there's a lot of people who also feel that, especially if you're working with high school youth who are about to go to college, a lot of them have been taught that it's better to de-emphasize your disability. And a lot of those youth don't know how to self-advocate. We're seeing a lot of youth who don't say that they have a disability. Like, for example, I just met with a youth the other day who said, yeah, I'm not disabled, but I need extra time on tests. And I'm like, well, that's a disability, and you have the right to ask for extra time on tests. But if you don't use some of those buzzwords in certain settings, you're not going to get what you need. But in terms of this particular conversation we're having today, we're advising the person first model. All right, next slide. And you want to avoid expressions like bound to your wheelchair, special needs. My all-time favorite Death Star, differently abled. No, go away. So don't say differently able, physically challenged. And some people don't even like person first language. I just talked about that. If you're not sure, just ask. Physically challenged was in vogue when I was in 7th grade. So I just started using it for like a day at church camp and it got weird. So I just like went back to like not. But I just feel like, you know, and I also feel like I want to say too that I would rather have someone say the wrong thing to me than not talk to me at all. So obviously there's a big difference than calling someone wheelchair bound and saying physically challenged, or the R word to physically challenged. So there are some different, you can kind of, if someone's calling me the R word, I may not give them as much a benefit of the doubt, and they may have to do some steps to heal that with me. But if they say physically challenged, you know, I might say, well, you know, I don't really say that. And so give me the opportunity to say how I want to be seen. And I'm opening up, and I can't represent the whole disability community, but because I've had personal experiences with some of these items, or most of these items, that's why I'm sharing my personal experience. But I am definitely not a monolith. And I am also a cisgender white woman who is upper middle class. So you probably shouldn't listen to me a lot of the time. All right, so let's go to the next slide, please. And we're not going to take a quick break, just kidding. And we're going to move to Cheryl.
Alrighty, thanks, April. And thank you for adding your unique perspective to the last few slides. That was very helpful. So again, just quick review. These are ADA requirements for public entities. They are not nice things that we're going to do to be extra kind to people with disabilities. These are federal and state legal requirements that we must provide equal or equivalent access to programs, services, and facilities. We must make reasonable modifications of our procedures and policies when we identify, or it's identified for us, that there's a barrier in our process, and we don't ask for proof of disability to make reasonable modifications. So as I said in the beginning, we are aware that our service providers are doing all of these things. We have heard some success stories and some very positive feedback overall. And we've heard a couple of specific stories that were really enlightening, but I was wondering if anybody here today would like to share an experience or a success story they had of accommodating a person with a disability in the COVID testing program. No success stories? I know there have been some. I heard of one clinic that actually had a staff person who was reasonably fluent in American Sign Language and has been able to communicate with and assist people who are deaf coming in for COVID testing.
Just to add on that, one thing that the testing program asked for was face shields. So that way they have access to be able to utilize those and bring down their mask for lip reading based on some feedback that the testing sites received.
Excellent. Excellent. That's what we love to hear. That is definitely a success story. So again, those hidden disabilities, you may not be aware of who might need to read lips to augment their hearing loss. So having the mask cover somebody's lips and face is a communication barrier to people who are deaf or hard of hearing. Okay, so let's talk about some specifics on how to achieve that equal or equivalent service for people with disabilities. A lot of it comes down to effective communication. We must provide communication with our customers, clients, and community partners that are people with disabilities, the same as we communicate with people without disabilities. And usually this involves people with hearing, vision, or speech disabilities. And quite often they will need specific aids and services in order to communicate effectively. And as a county program, we are required to provide those. We must consider the nature and complexity of the communication, though. Quite often with people who are deaf or hard of hearing, particularly people who are deaf and use American Sign Language or other sign language, they know that people who use ASL are not standing around waiting to assist deaf customers. They know that they're not going to get that service when they arrive at a public window, for example. So they may not request it in that instance, or they may request it, but you may find that if it's just a quick communication, like making an appointment or handing off information, printed information or something like that, maybe just writing notes back and forth is sufficient for a very brief contact. But if the interaction is more complex and they request auxiliary aids or support services to communicate, then we're required to give them the primary aid or service of their choice. We're required to give them their choice. And that's because they know what they need to communicate. If a person who's blind says, I need this document in Braille, and our response is, well, we don't have Braille capability, but we can make it in large print for you. Well, that's great. If they're a person who has low vision, that might work for them. But if they have very little or no vision at all, that's not an accommodation that's going to elicit effective communication with that individual. So we must give primary consideration to the aid and service of their choice. Some types of aids and services for people who are blind or have low vision. And by the way, most people who are legally blind have some usable vision. Very few people who are blind are completely blind. The stereotypical definition of a blind person is someone who lives in total darkness, but that's really not true for most people that are legally blind. So some accommodations that might assist people who are blind or have low vision are qualified readers. Qualified meaning they have the skills and knowledge to read complex documents and technical materials. Documents in large print, that's very easy to obtain. Generally, every document has a source document in Word, and you can just toggle the print size, the font size function. Many people who are blind like audio recordings. For a long time on the Disability Advisory Commission, which I staff, we have a blind individual, and his primary method of reading was audio cassette tapes. And so all of the information that I produced for the Disability Advisory Commission, I had to speak all of the material into a cassette recording and mail it to him. When I mailed out all the other documents to the rest of the members. Nowadays, we have screen reading software technology that can read most types of documents if they're properly formatted. And hardly anybody uses audio cassettes anymore. But there are different ways of producing audio recordings, including electronic files. And about 3% of people who are blind, and it's a declining number, still use Braille to read and write. But again, with the advancements of technology, Braille readers are becoming fewer and farther between. Nevertheless, from time to time, we do get a request for documents in Braille. The turnaround time on that is pretty extensive, like usually a minimum of a week or so. So for our purposes here, since information is changing so rapidly in this program, it would probably not be reasonable for a person to request any information in Braille. It just wouldn't arrive to them in a timely manner. So we would have to find a different way of effectively communicating with this individual.
Liz has her hand raised.
Liz?
Yeah, I have a question about Braille. I was wondering, so you said that most, like less than 3% of individuals like use Braille? What?
Yes. And it's generally the older population. It's largely not being taught.
Okay. So what about in the public sphere though, when you have like signs, or let's say you're at the shopping mall or at the library and there's not the possibility for using that new technology to be able to know like where you are or what store you're in, or there's probably better examples, but I'm just wondering like how people are able to access those types of things.
That's a great question. So the California Building Code, Title 24, Chapter 11B, has some specific requirements about Braille signage. So if you go into a county building, for example, we're up to compliance with signage at least at 700 H Street, our main building, and you will find at every doorway a sign that tells that reads, the name of the department and the room number, and that same information is embossed in Braille at the bottom of the sign.
But if people can't read it, if people are it's like falling out, then
it's falling out. Then
well, you said people aren't learning Braille anymore.
Oh, well, it's still currently a requirement, and it is still used by, some folks. So it is a requirement of permanent signage. And lots and lots and lots and lots of places are out of compliance with that.
Yeah.
It's very common.
Okay.
Good question. Okay, accommodations for people who are deaf. And by the way, deaf is with a capital D, like we say Black when we speak of Black Americans. They have their, unlike most other disabilities, like April said, they are not monolithic. But deaf people do have their own culture because they have their own language and customs. They tend to be very insular because it's difficult for them to communicate with hearing people, and they are often discriminated against. So when we refer to deaf people, we use a capital D. Or people who have hearing loss, people with deaf blindness, and people who have speech disabilities often need qualified interpreters, note takers. They may benefit from real-time captioning. That's when somebody sits beside them with a computer and they have the screen adjusted to a font and contrast that is visible for them. And the captioner records everything that's being said in the meeting, and it pops up on the screen. Video relay service and video remote interpreting has become another technological advance where it's much easier now to provide American Sign Language or other sign language interpreting like Skype, through a service like Skype, where before the only method was to make an appointment and schedule an interpreter. There's a 2-hour minimum, and it often results in a delay in the person receiving service because that arrangement has to be made. And then another less commonly used technology these days, but it was once the standard, is TTY, telephone text machines. They are still used by some in the deaf community, again, mostly the older population, because with the advancements of cell phones, many deaf people text and do video relay to speak with one another via ASL. But you may get a phone call by someone using a TTY through a relay service where they are typing their conversation through an operator who will speak what they're saying to you. You speak back to the operator, and they type back to the person who's deaf or hard of hearing. If you've never used this service before, what's really great about it is the operators are happy to assist and educate you about how to use the service effectively. Any questions about services for people who are deaf, or hard of hearing or have speech disabilities? Or any experiences to share?
I was wondering, this is Holly, the school nurse. I was wondering how people are able to make appointments for their vaccines in the county that are disabled.
Liz, do you want to talk about that?
So Holly, as you know, I'm not really the vaccine guru, but thankfully we have our check-in with our vaccine team on Thursday. So I think this is a great question to bring up during the 30 to 45 minutes we have with Stacy and Mike. Let me see if Mike is on. Mike is not on. So I don't really have any specific information that would be helpful to provide, but we do have that venue set up on Thursday.
Okay, I was just curious. Thank you.
So I can join that call on Thursday if anybody had any questions. I will say generally, our office, the Disability Compliance Office, and April's office, RIL, and the Disability Advisory Commission and public health staff are all working collaboratively to identify and address any barriers that we are finding with regard to any aspect of people with disabilities receiving either testing or vaccination services. So we would like to hear about any barriers or concerns with regard to serving people with disabilities that you encounter, and we will help you navigate those. Thank you, great question. Okay, if you are working with a person who is deaf or hard of hearing.
I think this is my slide.
Oh, I just walked right over you, didn't I?
And you.
I'm sorry. Take it away, April.
All right. So I want to share some general tips for communicating with people with different disabilities. These next several slides will talk about different disability types and some ideas for effective communication that you may not have thought of. And again, this is not a monolithic list, and it's always best to just lead with that people would just lead with the idea of being treated how you want to be treated, and that people with disabilities are just like everybody else and want to participate in the conversation that you're having or the activity that you're doing. So for people who are deaf or hard of hearing, you want to face the person directly when speaking and keep your hands or objects away from your mouth, because obviously they may be trying to read your lips. So you don't want to have blockages in front of your face. Talk directly to the person, not the interpreter, and watch out for ambient noise and speak in a normal tone of voice. So you don't need, obviously, if they are deaf or hard of hearing, I've actually seen this happen where people will be like, ah, they literally will scream at the person. It's like, that's not actually helping. Or the most common one is shouting at the person who is hard of hearing. And the other one that I see a lot is talking to the interpreter and not the person. So the interpreter is the person who is the tool for the communication for the person. So you want to, even though the interpreter is standing right next to them translating what they're signing, you want to look directly in the eye of that person and just have a normal conversation. All right, next slide. All right. So people with speech disabilities, be patient and pay attention. And don't finish their sentences or presume to know what they're going to say. That's something that I see a lot, and I'll share. Ask them politely to repeat if you don't understand, or paraphrase back what you heard for clarification. And they may be using various devices to enhance or augment speech. So this is actually really something very common that we see. One of our staff members who gave me permission to share this story, she's in our senior management, and she is a person who stutters. And I can't tell you how many meetings I go to where when this person starts stuttering, people want to finish her sentences. So she's shared with me how she wants me to treat her as her manager. So there have been times where I've had to just interrupt that behavior and say, she's not finished speaking, because that's how we kind of have an agreement of how sometimes I'll do that as her manager, and then sometimes I'll let her handle it. I give her the autonomy over that, but that happens sometimes. And we also work with a lot of people who will, if they're nonverbal, they'll type something into their computer and their computer will voice it. That's what Stephen Hawking used. And a lot of people are scared that, you know, they're rude if they say, "What did you say?" But it's better to say, "What did you say?" than to just, you know, it's more disrespectful to just be like, uh-huh, and then like turn to the next person and be like, "What did he say? I have no idea." You know, that's just being disrespectful to the person. You wouldn't want someone to do that to you. Next slide, please. All right. So let's talk about people with blindness or low vision. You want to state your name and introduce yourself to others present when greeting. So for example, "Hi Liz, this is April. I'm here with Sammy. How's it going?" You know, just so if, you know, I'm just doing a pretend if Liz was blind and couldn't see who was approaching her. And then offer sighted guide, never want to push or pull a person. So sometimes I'll offer my arm to someone, like if I'm at a meeting with someone who's blind, I'll offer my arm if we're going to dinner or something after the conference. And describe your activities during the interaction. So sometimes like I'll be on the bus and my colleague Richard will step on the bus because we take the same line after work, and he's blind. He works at Society for the Blind. And sometimes like just the other day, I was like, "I'm turning my back to you because I am trying to tie my shoe or something." And I'm just letting him know what I'm doing while I'm talking to him because he's hearing me rustle and act nervous. And I'm trying to talk to him, but also pay attention to a bunch of stuff going on around me. So I'm trying to give him the same experience that a sighted person would have interacting with me. And let them know if you need to leave the room or in the conversation. I mean, that's pretty rude, right? To just like walk away from someone who wouldn't know the conversation was over and they keep talking to you. I mean, some of this stuff, it's like, I think some of this is obvious and some of it's not so obvious. And just be specific about describing location and surroundings to the person. So you want to give that person the same experience as a sighted person, especially during presentations. I didn't do this today because I had the understanding that I went into this with the assumption that we were going to be meeting with a non-disabled audience. But something I've gotten in the habit of doing at more public presentations is I will say, "Hi, I'm April, and I'm a white woman wearing a navy blue sweater with white polka dots, and I have brown hair," you know, or I'll describe what's on the visuals that are on the slides. All right, next slide. So people with emotional, psychiatric, or cognitive disabilities, you want to make the environment as distraction-free as possible. Sometimes you might want to move to a quieter location because they kind of can become overstimulated. Keep communication calm, simple, and focused, and be patient and allow extra time to complete tasks. Next slide. And then people with mobility disabilities, put yourself at their eye level. I have gotten a lot of neck injuries straining to look at really tall people, and it's really nice when I'm in a crowded room when people will take a knee. If they're comfortable and able to take a knee, that's always a sign of respect. But or just kind of just bend down a little bit to just kind of look at the person at the eye level, so someone's not craning their neck to look at me or for me to look at them. And never push, lean on, or hold on to the person's wheelchair. It's a part of their personal space. It's not like an extra. I mean, I think sometimes people want to be nonchalant about the wheelchair, so they'll overcompensate by basically like consuming my entire body. And it's like, that's actually not showing me that you're respecting my space. You're making it actually worse. So don't lean on the wheelchair or touch it without permission. And sometimes we may choose not to use our mobility devices. Like sometimes I also use crutches, not as often as I used to as a child, but sometimes I'll use crutches like to get gas and stuff, and I won't use my wheelchair. And you know, there's like reaching, lifting, grasping, opening doors, fine manipulation. There's different aspects of mobility disabilities. And okay, Cheryl is going to talk about a little bit about service animals. This is the most popular question we get at RAL.
It's a pretty popular question in the Disability Compliance Office as well. And everybody wants to know, how do I know if it's a service animal? Because we've got people bringing animals into our facility. I'm pretty darn sure this is not a service animal. So there are two questions you may legally ask. You may ask if it is a service animal, and if the person responds yes, you may ask, what service does it perform? And they should be able to tell you something that the animal does. Actually, it's going to be either a dog or a miniature horse under the ADA. Those are the only two animals that are legally service animals. So you can ask, what service does it perform? And they should be able to say something like, it helps me pick up items that I drop because I can't grasp them, or it pulls my wheelchair, or it signals me when I'm about to have a medical episode, or it assists me with my hearing. They should be able to explain something about a connection with what the dog does and how it assists them with their disability. Again, we do not ever want to ask about the nature of the person's disability. And please be aware that there are no recognized certificates or licenses that state that something is a service animal. There's just, there's things out there. You can go on the internet and buy one of those vests that says service animal, and it means absolutely nothing. Again, it may not be a dog. The other legal service animal is a miniature horse. I've never actually seen one in action, but I know they're out there. And they are very beneficial for people, especially people who are tall or large and need some stability. It helps them because it's a sturdy animal. It helps them with their stability and mobility. And they live a long time. They live about 30 years. They train very well, and they can be housebroken. So that is why they qualify as a service animal. Any other type of animal is actually an emotional support or comfort animal. They do not enjoy the same protections under the ADA and FEHA that service animals do. To add to the confusion, the laws and regulations are all different with regard to housing, transportation, navigating public areas, and those regulations are changing all the time. Recently, the airlines have put more restrictions on people traveling with their emotional support animals, because people are bringing things like emotional support peacocks and emotional support snakes and tarantulas, which often don't travel very well and disturb other passengers and crew. So they've now the airlines have dialed back their regulations to only allow bona fide service animals on airlines. And stay tuned, those regulations are probably going to change again. How do you tell the difference? Well, a real service animal is highly trained and well behaved. Now, service animals don't have to be necessarily trained by an agency or somebody with specialized knowledge. They may be trained by the handler themselves, to do something very specific to assist them with their disability. But nevertheless, a bona fide service animal, you will hardly even know they're in the room. They will curl up under a chair or next to their handler, and they will be very quiet. We really encourage county staff, even though it's not legally protected under the ADA and FEHA, to allow a client, customer, or community member coming into a county service, allow them to have the animal, even if you're pretty darn sure that it's not a bona fide service animal, if it's something other than a dog or a miniature horse, it's definitely not. But realistically, it may be the only way that person was able to leave the house, get on the bus, get in the car, or whatever, come and get their service. So unless the animal is disruptive, not under control with its behavior, odor, barking, fleas jumping off of it, something like that, unless it's really causing a barrier to them getting their service or others getting their service, we encourage you to allow it and make it work as best you can. We encourage you to identify a place where an animal could relieve itself if need be. Just, maybe a grassy area or someplace adjacent to the service area that would be appropriate. And then the handler is responsible for cleaning up after their animal. You do have to consider other clients or staff that may have pet allergies or fear of dogs. And that's just another workaround situation. And I know you guys have all been very, very creative and diligent about making those adjustments as needed to accommodate everybody in your program. So that's the skinny on service animals. It's a very interesting area of the law because there are many different regulations and they're changing all the time. So, but for our purposes, since our interaction in the COVID sites are just very short, if at all possible, we do encourage you not to make a big issue of somebody bringing an animal on site unless there's a behavior issue. Any questions about service animals? Thoughts, experiences? Okay, well, if there's no more questions, then we are going to wrap up with a few thoughts about planning for access going forward and some ways that April and I can assist you. April?
Thanks, Cheryl. So go ahead. So it's critical to think about access on the front end. I can't tell you how many times I'll get a phone call at REL and people will say, oh, there's a complaint, or we didn't do this, or, and then there's a lot, when you're not thinking about access on the front end, the consequences can be very costly to the business or to the entity. If there is a complaint that you have to investigate, time talking to lawyers and things like that. And as soon as things get to that level, it stops being human, and it stops, to me, it kind of prevents, a lot of meaningful community dialogue. I prefer things to happen at the community organizational level where we can work out problems together before you want to resolve things before they get to the complaint stage. And so a couple ways that you can, and I don't want you to just think of this as risk management. I know that, because of the nature of the ADA, the only way to trigger the protections is to, well, not trigger the protections, but the way that people with disabilities get their rights is that sometimes we do have to file complaints. That's how we are able to enact things. But it's really great when we don't have to do that, and that society can just realize, like I mentioned before, that people with disabilities are an integral part of society. And what I always tell people is that we are a customer base. I know that this presentation isn't geared toward private businesses, but I just want to say that if your nonprofit is selling things or doing certain things, think of us as like, we're numbers for you, or we're a revenue stream for you, or we're donors, or we're volunteers. Like, we could be an active member of what you are about if you plan for access on the front end. And if you leave us out, you're missing out on all those benefits. So one of the key pieces is designate a responsible staff person. So you could call them a site ADA coordinator, for example, and that person would be in charge of creating checklists and duty sheets. You always want to post an ADA notification. And I know I saw an email go out where I believe, I don't remember how many people were on that email, but there is Cheryl was kind enough to send a draft or a sample ADA notification, I think, to Liz and a couple others. So if you need that, we can send that to you of what the ADA notification looks like. And that's just a simple statement of that we follow the ADA, and here's how to request accommodations or modifications. So consider additional signage. So at RAL, during one of our site reviews, it was found that we actually didn't have a lot of signage to get down to our building. And some of you may know that RAL, our building, is actually not a bastion of awesomeness. Someday I will have my beautiful fully, it's accessible, but it's in the bottom of a basement. So we had to put some signage and make some modifications to our site just to make sure that people knew how to get down the ramp that was built before all these laws were passed. That's one of the issues with needing to be able to afford rent and still be close to accessible transit is, even though we are a disability office, our building's not as accessible as I'd want it to be. So, you know, and think about compliance versus usability. So a lot of the ADA requirements are like the minimum standard. Some of them are a little bit beyond the minimum, but a lot of things are like the minimum standard. So a lot of people think, you know, what is the minimum I have to do to make this accessible so I don't get sued? But if you think about that, you're not really thinking about usability. So an example I like to use is like, I was in a meeting with the Parks Department a couple weeks ago, and they were asking for advice on how to make the parks more accessible. And it's like, sometimes, you know, what I told them in that meeting is sometimes like, I'll see a section at a park that's accessible. Like, okay, so maybe they have a lookout that's accessible, but I can't get down to the marsh, but everybody else can get down to the marsh. Well, but maybe there's a way to get people with disabilities down to the marsh. You know, there's some things that are just not going to be completely scorched earth accessible because of the nature of the built environment. But if you do the very best you can, think about usability, think about how to not just think about the minimum standard, but how people can actually use this thing. Because, you know, it's like you might put something like, you know, I'm just going to make this up, like a couple extra inches off the ground. But then if a person in a wheelchair still can't use the object, it's not usable. You may be legally allowed to put it there, but what's the point if your customer can't use it? And you want to evaluate facilities for future uses too. So that's the other piece of why we came today, is that one of the things that RAL wants to assist all of you with is, especially after your site review reports are given to you, is how can we help you find further funding and further support to make all of your programs accessible to people of all types of disabilities and enhance your programs so you're planning for access. Next slide, please. And that's Cheryl.
Okay, for some reason, my slides aren't moving here. There we go. Okay, I want to circle back real quick to the ADA notification that April mentioned. That is a specific requirement of the ADA that we post the name and contact information of the countywide ADA coordinator. That would be my manager, Ms. Corey Stilson. And I have provided that document to Liz to distribute to all of the sites, the COVID sites, and you should post that in a prominent place along with any other notices, or if you don't have any other notices, just somewhere where it's clearly visible to your community members that are participating in your program. You may want to laminate it if you can, and make it part of your checklist of things to do to create access when you open your site. Is there a question?
I think someone just needed to mute their line.
Okay. Alrighty, so just to wrap up, here are some key concepts, key elements of effective services. Plan ahead for inclusion. You know that at least 20% of the population are individuals with disabilities. They're here and they're participating in our programs. We want to respond promptly and graciously to any requests for assistance, or if you see a need, we want to offer assistance, but ask before you help. Listen to what they tell you and do it their way. They know how to do it best for them. We want to treat everyone, of course, with dignity and respect by not making assumptions about what they can and can't do. If you're not sure, just ask and they will let you know how they can perform that particular function, or if they need assistance. We want to be sensitive about any physical contact, and especially with people who are using mobility devices. Words matter. The right words can make a big difference. The wrong words can hurt. And really, this is just all about meeting our customers' functional needs. It's not special needs. It's just customer service. Everybody has slightly different needs, and we're just meeting those needs. Thank you. Thank you all for your time today. Thank you for the very important work that you're doing to save lives and protect our community. Thank you all so much. Are there any last questions about people with disabilities, serving them in our programs, anything we've talked about today?
Liz?
Okay.
Liz has her hand raised.
You did include me on your PowerPoint. Is it okay if I share this PowerPoint with the community testing program?
Sure.
Okay, great. And are there any other questions? I just want to also talk about some of the next steps for the community testing program. Anybody have any other questions? Okay.
I'm sorry.
Yeah,
I do.
please.
Sorry, this is Shantae. Hopefully I don't get cut out. My phone's been going in and out the whole presentation. So yes, if we can get the PowerPoint, it'd be great. As we're going over like the ADA guidelines that we were sent, what are key things that we need to look at? I know you guys say assisting with like maybe ways to fix them, but what are key things that we should be looking at on those guidelines that they sent to us?
So Shantae, Cheryl and Jeffrey are during their site visit are going to be walking you through those items, and then they're going to follow up with a written kind of bullet point of what was discussed. So that way everybody can be on the same page on any next steps that might be available for temporary modifications.
Oh, perfect. Thank you.
Right. So we will walk you through it step by step. We will walk the path of travel and show where like safety cones are needed or additional signage or those things. We'll show you exactly where and how to place them. And then we will follow up with a written report that captures that information so that you can have it in your record. And we are providing any equipment that you needed, like the cones or the temporary signs. We are going to provide those on loan from our wonderful Department of Voter Registration and Elections, who has an arsenal of this equipment that they have used in the past for polling places that had access barriers.
Thanks, Cheryl. So yeah, the next steps is that we have, of course, this training. Some folks weren't able to attend. They've asked for it to be recorded, and so they can watch it on YouTube. So I'll be sending that out to the community program. We'll be talking this Thursday about the posting that we discussed earlier on this call. So that's on the agenda for Thursday. The one-on-one site visits are all scheduled. Woohoo!
Yay!
So yay! So that way we can make sure and the report. Everyone has been sent their report, so make sure to check your inbox if you want to take a look at that. And I think those are all the next steps that I have on my end. Cheryl, April, anything else that you want to name as a next step, even outside of what we're doing?
This is April. I just want to say that RAL is a resource to all of you. So I will make sure that Liz, if you haven't already done so, sends our information with our website, because one of the things we're mandated to do is to help our community partners become accessible to people with disabilities. So we have a lot of really great resources and tools and we can provide free technical assistance training on how to make different aspects of your program accessible, especially in the post-COVID world on Zoom. We have some great trainings on making PowerPoints accessible, Zoom support groups, for example, accessible, how you can do small groups and large group meetings accessible. So, and also physical accessibility as well. So we are here for you.
And the Disability Compliance Office is here as a resource as well. We're happy to answer any questions or navigate any questions of concerns about providing reasonable accommodations. And all of those resources that I mentioned with regard to providing interpreters and translation services, those kinds of things, the county has contracted service providers for all of those things. the hosting department, department hosting the program is responsible for the ultimate cost, but we have already prearranged those services on contract, and those are posted on the Disability Compliance Office website. And if anybody needs assistance with providing any of those services, the DCO is here to help.
And I need to jump off. Thank you, everyone. Have a wonderful day.
Thanks, April.
Thank you, April.
All right, so I'll just open it up one more time. Any last questions for Cheryl? Okay, well then I'm going to stop